So this class can either be the best of times or it can be the worst of times for you. You can either immerse yourself in the material, learn something that you can actually use to one day save your life, or you can just slide by, cram for the test, and not learn anything. You just leave the same exact way you did when you started. Because this whole class, all it is about is different choices that you make during life and how they have a direct effect on how your life turns out and how your health turns out. So this class just takes everything you've learned so far in physiology, nutrition, metabolism, and all the important things, puts them together and makes them hella actually relevant to our life. Like, okay, so who cares about these things? What do they actually mean for us? So this class actually tells you what it means for you. So as you probably know by this point, the number one killer in America is heart disease, which is always abbreviated as coronary artery disease or cardiovascular disease. Any situation that where it affects the heart, open heart surgery, cardiac arrest, coronary artery disease, whatever. That's number one killer in America. It's not AIDS, it's not cancer, it's not anything. It's any acute disease that you would think of. It's coronary artery disease. And the thing about this disease is it's a chronic disease, which means chronic diseases mean they start when you're young or they start at some age in life and they go on for 30 to 40 years until they actually hit and kill you. So cardiovascular disease and heart attacks, all that stuff, don't actually start when you get a heart attack. They start like 20 years before, when you start eating shitty food, you don't exercise, you have a really bad lifestyle. So that's how they all start, and they're all chronic diseases. And you can think about it, and this makes sense with America because we have a shit diet, we don't exercise, we really don't focus too much on health. That we should be, and this whole class will hopefully change that idea for you. So the very first part is about, you have to understand, is about risk factors and how risk factors affect the strength of your hearts. And I don't have a picture of the hearts, fortunately, but it's about how these 8 risk factors, they can either strengthen the heart or they can weaken the heart over time. And of course, you want to avoid things that weaken your heart, common sense. But through past years, there's been a certain study called the Framingham Heart Study. You don't need to know this, just for background information. But the Framingham Heart Study has been a study conducted by physicians, by medical professionals, exercise physiologists for the past like 50 years, just collecting data on what factors increase the risk of a heart attack and what reduce the risk of a heart attack. And they came up with, in the study, 8 risk factors. That it seems that patients who have these risk factors increase their percentage of a heart attack. And now most of these risk factors are modifiable, which means the lifestyle choices. So you make a bad choice, you suffer consequences, you increase your chance to have a heart attack. You make a good choice, you're good, you just decrease your chance for a heart attack. 2 of them are non-modifiable, which means you can't do anything about them. You're stuck with them, don't focus on them. But now we're just going to focus on all 8 risk factors because you have to know all 8 of these risk factors because they're very, very important. They're not just important for this test, they're important to also know because if you enter any health field, they're going to be doing these risk factors on every single patient because they're that important. And also it's pretty cool to be able to calculate the risk of your dad or calculate your own risk or calculate the risk of a friend and tell them things they should be doing and things they shouldn't be doing and all this good stuff. But now we'll just jump into the risk factors. So the 2 risk factors that are non-modifiable are age, and it's if you're a man and you're over 45 years old, that's automatically a risk factor. If you're a woman and you're over 55 years old, that's automatically a risk factor. The reason age is a risk factor is because your heart is a muscle, just like anything in the body. It's beating millions of times during your life until you die, beats till you die. So you just gotta think, if you contract your bicep millions of times a day, it'll get weaker because you have to give it a chance to strengthen and whatnot. So it's the same thing with the heart. The heart doesn't have a chance to rest. It constantly beats, so it's going to get weaker over time. So men's over age 45, because men's over age 45, just being over age 45 is a risk because your heart's so old. Women over age 55 is a risk. Reason being because women have this thing called estrogen. They go through a menstrual cycle, and estrogen has been proven to be beneficial. I don't know why the hell it helps, but it helps. So good for women. Women last longer than men in this instance. Second one is family history. Again, family history, you can't do anything about it. If someone in your family has had a heart attack or a heart condition, whatever, it's a risk, but you can't do anything about it, so don't dwell on things you can't change. Now for family history, if your father or your brother has had a heart condition before age 55. And this can be open heart surgery, it can be a cardiac arrest, or they've had a heart attack before. Any heart condition, not diabetes. Diabetes does not count as a heart condition, but any heart condition before age 55. So if they're age 56 when they had it, you're safe, it's not a risk factor. If they're 54 when they have it, it's a risk factor, because over many years of study, what they've shown is if it's before age 55, it's probably lifestyle choices. It's not because your heart just decided to have a heart attack. It's lifestyle choices. And then if your mom or your sister has had a heart-related condition before age 65, because again, the whole estrogen thing, menopause, whatnot, before age 65, then that's a risk. Now that doesn't mean if you had a mother and a father have a heart condition before these ages, it's 2 risks. They all just count as 1 risk. Now these risks are non-modifiable, which means you cannot do anything about these. So if you have these risks, okay, just note them, that's good to note, but you can't do anything about them, so don't dwell on things you can't change. Focus on the other 6 risk factors which you can control. The other risk factors we have is physical activity. Everyone probably knows this. Exercise is good for the body, it's good for the heart. It's a big shocker. And to be considered where you're physically active and make it not a risk, you have to exercise for at least 30 minutes a day, for at least 3 times a week, for at least 3 months. So very easy, just remember 3, 3, 3. Now what this means is if you get a case study and a client and they say the client has been exercising for the past 2 months, 20 minutes a day, whatever, that's still a risk factor because this is the minimum requirements to be considered where it's not a risk anymore. The 4th one is called dyslipidemia. Anything with any word with the word dys in it, or the prefix dys, means a bad condition. Lipids mean fat. Emia means a condition of. So dyslipidemia is a condition of high fats, and fat is a cholesterol. So we're talking about cholesterol in this instance. So if your LDL is above 130, or your HDL is below 40. Now LDL is considered bad cholesterol. You don't want this guy, he's bad. HDL is good cholesterol, you want as much HDL as you can get. Now the things that affect LDL is your diet, fried foods, diet, processed foods, whatnot. Exercise affects HDL. The more you exercise, the more aerobic exercise, I'll just say, it seems to increase your HDL. So it's common sense, exercise, decrease shitty food. And these are the numbers. The reason HDL is good cholesterol, so you want above 40. And also, if your total cholesterol is above 200, that's a risk factor. Now what this means is when she gives you the numbers on case studies, or if you're calculating it on a family friend or on yourself, you have a blood test, and your LDL is above 130 and your total cholesterol is above 200, that doesn't count as 2 risks, it's just 1 risk. And you can't just add LDL and HDL. It does not work that way. You can't add LDL, HDL, get total cholesterol. It does not work because there's other things going on in the body, much more complicated. There's many things going on, so you can't just add them together to get total cholesterol. So that's 4 risk factors. 5 is obesity. And the cutoff or criteria for obesity is a BMI above 30. And we'll go over on how to calculate BMI later. But at this point, everyone should know how to calculate the BMI. It's the second test. It's a very easy number to calculate. It's seen in every single hospital. It's done in admission assessments in hospitals, nursing assessments, vital signs. So everyone should know how to calculate this. It's a very important number. And number 6 is hypertension, high blood pressure. So really all these risk factors people have heard of that they're bad for the heart. But in another video, I'll explain exactly what is blood pressure and why it's bad for the heart instead of just memorizing a number, because I hate memorizing things. Hypertension is a blood pressure of 140 systolic over 90 diastolic. It can be one or the other. So if you have 140 systolic but 70 diastolic, it's still hypertension because you got one of the criterias. 7 is prediabetes. Prediabetes is a measure of blood sugar. And by this point, we know that blood sugar or sugar, our body runs on sugar. We get sugar from food, sugar, glucose, same thing. And once we eat the sugar, we have our cell, we have a bunch of sugar that we just ate. And this sugar cannot get into the cell. It can't get this, the cell's impermeable to it. So what you do is your body releases insulin. Insulin is very important in this class. Very important to know for the heart. Your body releases insulin, and insulin allows it to get into the cell. So insulin kind of like opens the cell up for it. Now in a pre-diabetic or someone who has a shitty diet, who doesn't exercise, what happens is they've released so much insulin that eventually the cells are tolerant to insulin, where it doesn't really have the same effect. Just like alcohol, you drink a lot of alcohol, you're going to be tolerant to the same amount of alcohol, and you need a lot more to get the same effect. Well, it's the same thing in the body. You release so much insulin, you flooded your cells, so now your cells are insensitive to insulin. That's the word. So we'll just write that down, insensitive. Just because that's such an important word, insensitive to insulin. So your body's insensitive to insulin, so insulin does not work. So what happens is your blood sugar is elevated after 8 hours of fasting. Everyone's blood sugar will be above 100 when they just ate, but after 8 hours the blood sugar should be lower. But in this instance, where someone's insensitive to insulin, the blood sugar is still high. It's between this number, 120 to 125. So they're considered pre-diabetic. That's a risk factor. And of course, you can increase your insulin sensitivity by exercise. That's why it's such an important word, because I know that's definitely a question. Exercise increases insulin sensitivity. And the last one, of course, is smoking. Everyone already knows this. Smoking is bad for you. Don't have to reiterate it. So pretty much, if you're smoking or if you know someone smoking, please stop, because it's not only a huge risk for cardiovascular disease, it's a risk for every single chronic disease, every single disease in the history of man. So just stop smoking. Stop doing it. But smoking is a risk factor. And the criteria is you have to at least be free of smoke or not smoking for at least 6 months. So if you have a case study, 5 months, it's a risk. If they quit 7 months ago, it's not a risk. And also, secondhand smoke is a risk factor. If you're even around smoke, it's a risk, because essentially if you're around smoke and you're inhaling it, it's the same exact thing as smoking. There's no difference really. You're inhaling the smoke, it's the same thing. So these are the 8 risk factors. 6 of them are modifiable, 2 you can't do anything about. So focus on the 6 that you can affect just by lifestyle choices and choices in your body and choices in your life. So essentially, in the next video, we'll go over how these risks, what they use these risks for, how they can classify you as low risk, medium risk, or high risk, and essentially calculate your percent that you're going to have a heart attack some point in your life. In one question that she asks on every single test, that's everyone probably does know this by now, exercise. She asks us, like, how does exercise affect these risk factors? Well, exercise is the best thing you can do to fix all these risks. It affects every single risk factor, of course, minus age and family history, but it helps obesity, lowers your body weight, obviously. It helps smoking. I mean, if you're always smoking, you're exercising, obviously you're doing something good, but you're also doing something bad, so it's like you're canceling it out. But it can help reverse some effects of smoking had and make your heart stronger. It helps with blood pressure because it lowers blood pressure. It makes you sensitive to insulin. So write that again, just because it's very important. It makes you sensitive to insulin. It increases your insulin sensitivity, which helps you, if you're diabetic, you can actually reverse diabetes by exercising. And it fixes dyslipidemia, it can lower your cholesterol, raise your HDL. So exercise is good. That's the end story. Exercise if you're not.